My name is Michelle. I'm the nurse practitioner at 180 Health. I'm here today with one of my patients. This is James. James came to us. He'd been using chiropractic care to control his pain and his osteoarthritis, and had gotten to a point where he was having a lot of pain and difficulty working out and in his very demanding job. So James came in and had a regenerative medicine procedure. He actually had regenerative medicine combined with platelet-rich plasma, which is from his own body. And he had that in about July. So we're about 6 months out from procedure and physical therapy. Was coming in and having this done, was it pretty easy? Did you have a lot of downtime?
Procedure was extremely easy. I came in, got the injections, no downtime.
Medication, did we put you on a lot of medication, like pain medication or anything?
No pain medication at all. Took Tylenol for a day or two.
That was it?
That was about it.
Okay. James also had to have braces on his knees, or an easy offloading brace that he wore when he was working or did any kind of physical therapy, any kind of strenuous activity. And then James started therapy at about a month out from his procedure.
Yes.
And he did therapy here. That is one of the options that we have. And how was therapy? How'd therapy go for you?
Therapy was a little difficult at first,
Yeah.
but then it got easier as time went on.
Yeah. And James actually had COVID not too long after he was injected.
I had COVID probably within the week.
Mm-hmm. And so he actually came in and started therapy with kind of a slight setback. So he had actually been down a little bit, so he had quite a bit of time to make up and quite a bit of muscle. So we worked on that too. We talked about supplements while you were here. We started him on some stuff to help build muscle from those that kind of atrophy just a little bit and to gain strength. And James also comes in quite often. He'd actually started before that and gets quite a bit of immune boosting therapy like B12 shots and vitamin C.
Yes.
Yeah, and do those work pretty well for you?
They seem like they do, yeah. My energy is a lot better from the B12.
Okay, good. And actually James put a lot of hard work into therapy. Like I said, he worked really hard. We're about 6 months out. And have you seen any changes? Do you kind of describe your process? If you're feeling better, is it easier to work or work out?
My process is a lot easier now from the therapy and the shots. I'm able to perform my job a lot better. As far as my workouts go, they're getting better, getting a little stronger.
So if you have friends that are contemplating surgery, have knee pain or shoulder pain, would this be an option that you would kind of talk to them about? Would you recommend it?
Yes, definitely would recommend it. I would have them come in and talk to you guys and so they can get evaluated. Yeah, it'd be something that I would highly recommend.
Good. And James is like part of our family. He comes in all the time for supplements. He comes in for dietary stuff and for functional medicine besides his regenerative care for his osteoarthritis. So that's what we like, is our patients to come in and be treated for not only pain, but for a better quality of life. And I'm hoping we provide that to James.
Yes, most definitely. It's a lot better than it was. Yes.
Good. All right, well, if you, like James, are suffering from osteoarthritis or any issues that are causing you pain and you would like to be evaluated, please come in and see us. We've been more than happy to evaluate you and see what we can do for you and make you part of our family.